friends in college, what are you passionate about? Passionate.
The Passion Show on CFRU 93.3 FM Guelph, Ontario. With Wizard.
I'm a what? Or Wizard, Harry.
With
Hello world, you are listening to The Passion Show on CFRU 93.3 FM. It's a do-it-together radio show all about passions and the people who have them. My name is Wizard.
And I'm Connor.
Connor. Cosmo. The man.
The man, yeah.
Big dog.
Yeah, it's been a long time coming.
These are all things that we call you.
Yeah.
Mr. Connor.
Plenty of names, plenty of hats.
Plenty of hats.
Depending where I am. Yeah.
Hey, I mean, that describes us all.
Yeah, exactly.
Sometimes I wear a wizard hat. Sometimes I don't.
Sometimes you don't. Sometimes you wear no hat at all.
Sometimes you wear the hat of a paramedic. Sometimes you wear the hat of a camp counselor.
That's right.
Sometimes you wear the hat of
anything in between. Dishwasher, whatever.
Welcome to the show, Connor.
Thanks. I appreciate it.
It's such a pleasure to finally have you here.
Yeah, we've been talking about this for a little bit, but I'm glad that we can actually sit down and do it.
We're running through these Celtic people.
Yeah, you're really getting through everybody in Guelph at least.
Yeah, I'm trying. It's kind of concerning.
Yeah. Well,
it's amazing though. Since the very start of the show, it's always been a concern for me that I'm going to run out of people. No. But I just somehow never do.
Yeah, there's no way you're gonna run out of people. They'll come out of the woodwork too.
Exactly.
You put out a call, there'll be people lining up.
That's the thing. I've never had to put out a call.
No.
I put out a call right at the very start of the show.
Yeah.
And I have never had to go on the internet and say, someone please be on the show. It's just bespoke interactions for everyone who's been on here.
I kind of like that though. I feel like it's more candid. It's more,
100%.
More what you can do.
I'm just, whoever needs to be on this show, whoever the universe places in front of me
is who's going to be across from me.
Winds up on the show. And whoever the universe says no to being on the show is not allowed on the show.
Can't come on.
Like our friend Boots, for example.
Yeah, well, listen, Boots, if you're listening, I mean, she'll be back.
I'm 100% sure she'll
be back.
She'll be back. She'll end up on the show somehow.
That's right.
But enough of this this esoteric. It's funny that this is on the radio, huh?
Yeah.
This is for all to hear. Us talking about our friend Boots.
Yeah. I don't even know if those radio waves are reaching it right now.
No, certainly
Definitely not.
My dear listeners, our friend Boots.
Yeah.
Exactly. That's the chair.
That's
where the
chair.
listeners sit.
I got you.
Our friend Boots is a real patron of the show.
Yeah.
And has been with it since day one. But she's never been on the show.
Never been on.
And perhaps she never will be. Maybe that's how the universe feels.
Perhaps you'll I was gonna say film your last episode, but you'll record your last episode right when she gets back.
I'm sure I will. I may
again.
very well film my last episode.
Oh.
I am in. This is the season 6. This is the 6th season.
Dang.
Of the show.
Yeah.
Maybe I'll do 6 seasons in a movie and call it a day.
And that's it.
Yeah.
You're gonna do a movie?
I was thinking about it.
Yeah, you should.
I think that'd be really cool.
Every guest has to appear in once.
I was thinking it'd be a party. It'd be like a Project X.
That'd be fun.
And then film it and make a Project X movie.
Yeah.
The Passion Show guest party.
And get everybody together.
It'd be pretty nuts.
And then Boots can be the final guest.
Yeah, Boots shows up. Boots is the villain of the motion picture.
Shows up in room.
It's not the worst idea.
No.
What do you do? Who are you? What's your deal?
So, yeah, I mean, you're right. I go by various names. I mean, Connor to those who knew me prior, and many of those who know me in Guelph, but Cosmo to actually a lot of people now, which is kind of weird to think about. But
trust me.
I mean, I'm wearing a garment of clothing with my name on it.
Fit. For our listeners, he's wearing like a bespoke Camp Celtic staff wear.
That's right.
With the little cartoon sailboat on it, which is awesome.
Shout out to Uki.
None of our stuff ever had. Oh, is that a Zuko Blue?
Handmade, yeah.
Zuko
Blue.
Gosh.
Yeah.
Everyone, go on the internet and type in Zuko Blue and check that out. That's an official endorsement.
Yeah, that's a whole other,
handmade clothing articles. I should get her on the show.
You should get her on the show.
She'd have some
be a good,
interesting things to say about fashion.
I think so too.
The only fashion I wear is the same Hemsmith sweater for the past decade.
Yeah.
Also, go on your computer and type in Hemsmith and buy some of that stuff. We love clothing here.
Plenty of sponsorship here. We got,
yeah, right? Yeah, this isn't candid. This is sponsorship.
Yeah.
Nah, I'm only kidding.
No.
But it's got Cosmo on the sleeve.
Yeah. But yeah, I mean, so obviously working at Camp Celtic, working, living, breathing that place.
That sweet Bruce Panous air.
Northern air. Yeah, I was a Wizkid at one point.
You're not the first Wizkid to be on the show.
Oh, really? Yeah.
I mean, Strudel.
Yeah, true.
All the way back in season 2.
Yeah.
And I'm sure there'll be more Wizkids yet to
you can probably find more.
For our listeners at home, these episodes are getting so contextually confusing.
Yeah.
The conversations as I go on get less general and more specific.
Yeah.
I've had that pointed out to me. A Wizkid
we got to do some definitions.
is what I used to call my campers at Camp Celtic.
Yeah.
I'd be like, you guys are Wizkids now. It was a real good life hack at getting my campers to and listen to me and enjoy their time.
Yeah.
So be a part of it. I was like this obviously sort of different looking weird counselor.
You're right.
And I was like, okay, kids, lean into this. Like it's sort of a cult.
Yeah, you're one of us now.
Exactly.
Yeah.
And I always had some good wins with that.
Yeah.
But you were a Wizkid.
Yeah, all that to say I've known you for quite some time
That's
now.
True.
And in various capacities. But yeah, now living in the same city, it's been fantastic. We've been able to go climbing and wandering around in the streets and
around on the street,
doing podcasts,
seeing music, making podcasts, radio shows.
Yeah. in my spare time, I'm a paramedic as well.
Spare time paramedic. Imagine that.
Technically full time.
I was gonna say, what is not your spare time?
Yeah,
then?
No, my spare time is few and far between these days. But yeah, no, that's my main gig is being a paramedic in this lovely city here. Yeah.
This is one of the only episodes of this radio show that I have come in with a title for your episode already cooked up.
Oh, really?
It's almost never. Usually when I have to name them in order to put them on, or I think it's fun to name them.
Of course.
I could just call them the name of the guest, but no, I want to have a fun name. Usually it's an extremely last minute thing.
Okay.
Not you.
No. This was predetermined.
This is predetermined. We're calling this one the Mobile Pit.
The Mobile Pit.
Or perhaps the Pittmobile or something like that.
I like it.
The pit on the move.
Yeah.
Because you're in a pit on wheels.
I mean, it's true. Yeah. It's been quite the journey doing this whole paramedic shenanigans.
I would like to know about it.
Sure. Yeah. You want the story?
I've always been very curious. I want to know the story of how you became a mobile pit driver. Yeah. I want to know some day-to-day.
The pit crew.
Or just whatever you'd like to share. Yeah. Tell me about it.
Well, I mean, that's my passion these days is medicine and emergency medicine. But yeah, it started when I was young.
Okay.
It started when I was, I want to say, probably 12, 13.
Okay, roughly when we met.
Yeah,
That's
probably,
cool.
Actually, yeah.
That's exciting.
And I was just a young boy in I guess, what is that, grade 8, 7?
7.
Yeah.
Something like that.
And my parents, so I used to want to do, or I guess I was signed up for doing the lifeguard training stuff and all the,
classic,
swimming things and all that. But for one of the things, I had to get my bronze something medallion,
bronze cross, bronze medallion, bronze potato.
Yeah, exactly. And part of it was doing first aid, and so I did a first aid class through the YMCA or whatever it was, and I was like, man, I really like this part of it. I don't really like doing the whole swimming thing, but I like this on land training that we've been doing. And so I asked my parents, I was like, is there anything like this, where it's just the, and young as I was, I had no idea.
That's so funny.
Kind of that was sort of a field of study, you know what I'm saying? But they were like, yeah, actually, we heard about this thing. You can go and be a cadet in the St. John Ambulance Cadets.
Oh, holy.
And so it was like, yeah, this volunteer organization that I'm sure many of the listeners may have heard of or taken a class from.
Me included.
Yeah, St. John, right?
I've got many a first.
You got
aid
some
from the
certificates
homies, from the saint.
Yeah, from the saint himself.
From Jonathan.
And so I joined them when I was young, and it was this like cadet program, kind of similar. We did like drill and marching and stuff, kind of like Army cadets, but it was all towards this whole like first aid side of it. So like part of it was learning how to like do all this first aid stuff. And then when I was crazy. It was, I didn't even know that existed until and then once I got older, like I was 16, and they were like, you should become a part of our medical first responder program and to like go out and volunteer. Because the other thing that St. John does is they go and like sit at sporting events and stuff with like an ambulance and do like first aid for big events or anything, right?
Okay.
It's kind of like when the cops sit downtown like at a construction site or something.
But way hipper than
but
that.
a little more chill. And so I started doing that, and I was like, man, I really liked learning about like the medicine and the how to like treat people and things. And I was like, this was a time in my life where I was having to pick what I was going to do after high school. And I was like, you know what, this actually might be something I'm interested in. And so that's how I figured out that the world of paramedics existed, other than like my basic understanding that they would come to my house if I like hurt myself or something, But that's how I got into it. And then from that time, that was just when I decided, okay, this is the goal. And I went about it.
It is one of those things where in my head, my unchallenged like assumption about it is I just never was curious to wonder where paramedics come from.
Right.
I was like, that's kind of just a thing that exists.
Yeah.
There are paramedics and they exist and they do that job.
And I think a lot of people think of it that way, especially
100%.
especially in specifically like what we call pre-hospital medicine. Because that like paramedics are the only like pre-hospital specialists, would you say, of medicine, at least in the civilian world, because you have your army guys and stuff. But it's interesting because I mean I think you think nurses and doctors and stuff. It's like I feel like there's way more of that in the media, and there's way more of that in just people kind of very much know what they do and know their whole spiel. But I feel like if I were to ask anybody from the general public like exactly what paramedics can do, maybe, or like
that's a big gigantic question.
No idea.
I know what they do in the once they get to the pit,
right? You see them come in and drop them off.
They drop them off, and here comes Dr. Robbie.
Dr. Robbie comes through.
Asks some questions of you. He's like, all right, Connor,
yeah,
what's going on here?
Yeah,
and then that's it. Let me say bye bye,
and then they're off the screen because they can't have that many lines.
Exactly.
Yeah, but no, that's what I think is really interesting. And the more that I've kind of gone through paramedicine and being
paramedicine,
that's the other umbrella
I suppose
term.
It makes sense.
yeah, right. But like pre-hospital or paramedicine, like I feel like just people don't have a huge misconception or just not a real understanding of what we do, other than they go to car crashes and stuff.
They pull the cars apart and get the guy out of there.
Get the people out. Yeah, but it's crazy like how much it's even grown in such a like it's a very new profession. That's I think something that people don't know either. Is like doctors and nurses have been around since the since the beginning because we've needed them, right? But there was this ever growing need for paramedics because they were realizing that a lot of people don't actually even make it to the hospital before bad things happen. So it's a pretty new profession, but it's still growing, which is kind of cool too.
What I love about having you in here right now is that it's a very rare you're the rare guest who is bringing a passion that I know literally nothing about. Zero things. I even kind of know about. I had a nurse on here a few weeks ago. I know a little bit about nurse stuff. My mom was a nurse. I love the pit.
You're exposed to that world.
But the world of paramedicine is just. I think it's just you. I just have known that that's your field.
Yeah.
You've told me a little bit from time to time.
Here and there, yeah.
But that's it. And so I don't even know what to ask. I'm just, the main question is just like, oh, wow, that's neat. Tell me more.
Yeah. Yeah. I guess, like, I don't know. You wanted to know about sort of the day-to-day. I guess that's kind of cool.
That's sort of my big question these days.
Cool
that's
thing
the
too.
phrase I'm coming around to. Give me the day-to-day.
The day-to-day. Show me
what's the, like, normal?
Give me So, I mean, like, one thing that we do share with nurses and doctors, we work 12-hour shifts instead of, the 8-hour usual. And it's always like start and end at the same time, like 6, 7, 8 o'clock, and then you end at 6, 7, or 8 o'clock in the evening as well. And
okay, sorry.
Anyway.
Okay, yeah, 6, 7, or 8.
6, 7, or 8 o'clock. Yeah.
This is degenerate. I'm so sorry.
This is awful. Anyway,
let's just glide right past that.
Yeah, we'll keep going. And but yeah, so I come in and you always do like the handoff, and I feel like it's similar in the hospital where like the nurses from the night shift give the report to the nurses from the day shift because they're taking over the care of the people. But the difference is that we don't have our patients yet.
Yeah, your patients are just
our patients are
little moments.
Who knows where, when, how, that kind of thing. So we get in and you do your like truck check and stuff. But something unique about the job, I feel like too, is that when you get into work, you're at work. You're available for calls. So like there's been times where I literally like I'm opening the door to the station and the like tones, the alarm is going off that there's a call. And so you just like go, oh, all right.
It's
let's
like, okay,
get
I'm
in
here,
there.
and now
yeah,
it
like
begins.
I guess we're going.
Like
It's like, so throw it into the truck and stuff.
That's crazy.
Yeah, so that
that feels different than a lot of jobs.
Yeah, because I feel like
warm up and no like, all right, situate myself, sit down at my desk.
Because even if like you're gonna start your job in like pretty much right away when you get in, there's at least like go to the bathroom, sit down, like put your stuff and so we always like we're always like, oh man, because it's you don't get time for your coffee or your whatever. But
it's like when your kunkel shows up first.
Yeah, exactly. And you're like, this is an hour before they said it was going to be.
We can't be okay.
Yeah. Okay.
A kunkel.
Okay. Context break.
Context to your listeners.
Yeah.
Kunkel is the name of Ontario school bus company.
Yeah.
They make school buses.
And they drop off kids.
They drop off kids at Camp Celtic Summer Camp. Now, if you're a Camp Celtic Summer Camp counselor,
you know exactly
what we're talking about.
Yeah.
Because when the kunkel comes around, you don't get to choose when the kunkel comes around.
No, the kunkel chooses you. Yeah.
The kunkel shows up when the kunkel wants to show up. And maybe that's a bit of a metaphor.
Yeah.
For life.
Kind of similar. Yeah,
life is like a kunkel.
Life is truly
Death
like
is
a
like a kunkel.
Death might be like a kunkel too.
You don't know.
You never know when it's coming. You don't know
when the kunkel's going to pull around the corner, and you never know if it's your kunkel.
No.
Might be someone else's kunkel.
Yeah, you have to wait and see. Well, and that's the thing too. Like, it's funny because we going back to we start out the day kind of being surprised or maybe just like you have no idea what's around the corner. You also have no idea what you're walking into, like because the dispatchers give you like some idea of, they're like, okay, you're going for a 20-year-old male fell off a bike, or whatever, and
that can mean a lot of things.
And that can mean anything. Like that can mean like he's in real rough shape, or it could be that he's completely fine.
Or he could have broke his spine.
Yeah, like you have no idea. And they, the dispatchers try and they give us like, and this is no diss to dispatchers. I mean, we work very closely when we love them too. But
I recently watched a whole 30-minute video of a dispatcher talking. It was like one of those Wired interviews, professionals or GQ or something like that. And I was like, wow,
they're awesome.
Well, that's another job that. It's just something that you don't think about an actual person doing,
something
and what the
like
day-to-day that is.
Nobody knows about, like, other than, they
and what
give
an
out
intense
calls.
thing that must be. You're just sitting there, and the phone's going to ring, and who knows what's going on.
Yeah, who knows? And, like, the amount they have to manage, like, because they have their, like, call takers who take the calls, but then there's only one dispatcher that manages all of the ambulances in the area. Yeah.
And there's got to be some, like, triaging to that, too.
Oh, yeah. Yeah, there's tons.
Like... disgusted. The idea of being involved in triage at all makes my stomach turn.
Yeah, and like who's going where and like lunch breaks and things, because that's the thing I think too is like the human factor of it all, because like we still need to like eat. We still need to like sit down every once in a while and stuff. And that's what's also so strange is like you never know what your day is going to look like. And like it's depending on you where you work. Like if you're in a big city, you're probably going to be busy because there's just lots of people
nonsense
calling 911 for whatever. But then, you know, like there's been days where I've been up in like Wellington County where there's been nothing. Like I've sat there for 12 hours and not had a call.
Wow.
Yeah.
You just get a lot of Sudokus.
It's just a lot of Sudoku, a lot of, like Netflix watching, like, you know, whatever.
Let's go.
Yeah. So, yeah, but I like to be busy.
I prefer being busy.
I like being busy, and my role has taken on some different things over the years of me doing it. Because that's the other thing. I mean, did you have any idea that there's different levels of paramedic in Ontario?
No idea. I thought, and these are all
just one
thoughts that are
thing,
just like, you can barely even describe it as a thought. It's just a vague assumption.
Yeah.
It's like, yeah, you're just a paramedic.
Yeah.
You go in the ambulance and drive it around, honk.
Yeah.
Fix them up.
That's
what the paramedic does.
That's exactly
But apparently
right.
That's not so.
No.
There's more to it.
There's more. There's 3 levels.
Okay.
Yeah.
Excellent.
So
tell me more.
And so, like, there's primary care paramedics,
Okay.
which is what you see most often. It's like people, it's like the bulk of paramedics in Ontario. And they have all the skills to do all the things to save people's lives. And then you have advanced care paramedics, which is what I am.
Let's go.
Yeah. So, I went to school for an extra year and a bit to do a bunch more training, and did some training like in the hospital, in the operating room, and in the like emerge department, and with sick children as well, just to learn all that stuff.
Sweet.
And now I got the good drugs that I can give people, and a bunch, just like a ton more skills than I had before to be able to do interventions like you'd probably see on the pit.
Yeah,
which
so you're
is
doing
cool.
some pit stuff. You're putting in, what's it called when they put the tube in the throat?
Yeah, intubation.
Intubation, of course.
Yeah.
They do a lot of that on the pit.
Yeah. Have you seen the bone gun? The drill
what
that they use on people's bones?
They do that a little bit on the pit.
Yeah.
Put the bone gun in there.
I'm a big fan of the bone gun.
Cool. So for the listeners at home, it's a gun that shoots bones.
No. Yeah, that's exactly.
If you're curious.
No. It's like a, well, they call it an IO because there's IV, right, where you like put the thing in somebody's vein and you can give them like fluid and drugs and stuff. But then someone decided, someone way smarter than me thought, wouldn't it be cool if, say we couldn't get an IV, if we could just put all that fluid and drugs into the bone instead?
The fact that works blows my mind.
I know. I'm
That's
like,
so insane.
Who came up with that?
What the O is what, like
intraosseous.
Osseous.
Yeah.
Because the V is venous.
Venous, intravenous, intraosseous.
Look at us.
And there you go.
That's so sick.
But yeah, it's crazy, and it's really cool.
And you can do that. You're allowed to do that.
Yeah.
You're level 2.
That's right.
You're level 2 boss. You're not level 1 chump.
No, I'm the mafia boss now. Yeah. So yeah, that's been cool, and the big one is being able to do the pain meds as well.
Okay.
Because primary care paramedics can only give Tylenol, Advil, and this other one called Ketorolac, but it's basically just Advil in liquid form. And so think about it. You've been in this big car crash. And
tell me about
it. Maybe rolled a minivan or something like that.
Something like that. For our dear listeners, tune in to the episode 7 of this show with Claire Shebad for a little context on that one.
Okay, yeah, sure.
Let's suppose you've rolled your minivan.
Let's suppose you've rolled your minivan. And say you've like broken your arm or something.
Oh no, my arm is broken.
I mean, presumably you'd be in a lot of pain.
I want morphine, Connor. Give me morphine.
Right. Now, what if I'm a primary care paramedic and I say, actually, all I can give you is Tylenol and Advil?
No! I'd say, I can do that.
It's kind of crazy, right? Because you're like, what the
Advil.
heck? And I mean, studies would show that Tylenol and Advil do a pretty good job, but only after like an hour.
Yeah.
Right? So it's like, it's nice to be able to finally give some like fentanyl and morphine and things like that can actually relieve pain really well. And funny enough, actually, on that one, which you might find interesting, is
I find a lot of stuff interesting.
Right?
Lay it on me.
is they just allowed us to use a new medication for pain relief.
Oh, boy.
Ketamine.
I do find that interesting.
Yeah, it's very interesting.
I do find that quite interesting indeed.
Yeah, because, I mean...
that is a powerful substance.
It's a very powerful substance.
I didn't know that you were doing medication on horses as well as people.
Yeah, no, it's just people. But, ketamine, they found, is, yes, a recreational drug, but it's primary...
So they say.
So they say. I mean, from what I've heard.
Yeah.
But they figured out that it's actually really good for relieving pain too, because instead of taking the pain away from your leg that's broken, you just don't remember you have a leg. Is their idea. You know,
I mean, it makes sense.
Yeah.
It makes physical sense to me that a substance that has that effect on your brain would be a
good for
an
pain.
effective painkiller.
Yeah, and I just think that's so cool because, too, I mean, it makes you not remember either, which is another thing. Like, I mean, you're going to people on the worst day of their lives sometimes in these, like, accidents and stuff.
And that can leave some trauma.
Certainly, yeah. Trauma. Like, there's the physical trauma of all of it, but then there's also the lasting, like, you know, they're going to remember that for the rest of their lives. So it's kind of nice to be able to take away some of that memory sometimes.
Man, that's interesting.
Yeah, it's cool.
I need to just get medical professionals in on every... I love it. These are always my favorite shows. Yeah. It just blows my mind.
It's been cool. And then recently I've been on... I got a new contract. And so instead of being on an ambulance, I'm now on an SUV.
Okay.
Just by myself. So I don't I don't have a partner anymore. So some days are very lonely. It's like it's like 12 hours of just driving around sitting in parking lots.
Skirt.
But other days, so my whole thing is I'm what's called like a first response unit.
Okay.
So
you are certainly a unit.
Yeah, right? The first response Pittmobile. And it's been really interesting because I get called to all the like higher acuity calls that the ambulances get called to, but because I'm roaming around the city driving around, I get there first.
Yeah, okay.
So I usually get there alone and go in and figure out what's going on, and then
so you're like prepping the scene a little bit.
Yeah, I try and like stabilize them or do what I need to do before the ambulance gets there, and then I give them a report so that they can take the person and do whatever. But because I'm a level 2,
I'm presenting.
Yeah,
is that
exactly.
What that's called? Presenting.
Yeah. It is cool too because I get to like give like a little report. Like it's a very
Give
presenting.
me. I would like to. We need to stop talking about the pit. Or, I don't know. I say we.
We're gonna get copyrighted or something.
Yeah, right. Don't come after us, Pit.
Yeah,
don't come after me, Noah Wiley.
We love you.
I'm curious to do a little bit of role playing.
Okay. Yeah. Sure.
Let's suppose I'm showing up. I'm driving the ambulance, and you're you.
Sure.
Present something to me.
Okay. Sure. Yeah. All right.
What's going on, Connor? I'm a level 3 boss.
You're a level 3 boss. Holy. Okay. Hey guys. It's so I have a 20-year-old male here. He's complaining of a broken leg. It looks like he fell from a height off of a scaffolding. He's got pain. It looks like a mid-shaft femur fracture. Ooh. We're probably going to have to get some kind of sagger on it to get traction on that, mid-shaft femur fracture, elongate it out a bit. I'm just going to give an IV. He's vitally stable. He's got, he's a bit tachycardic. His blood pressure is good. I would normally give numbers with that too, you know what I'm saying? But, and then I would just kind of tell them anything else they need to know about, like, medical history.
Same character.
Okay, I was saying character. So
what else do I need to know, doctor?
So he's allergic to penicillin. He's got, dextromethorphan's the only medication he's taking because he's sick right now.
Gotcha.
No fever, no previous illness, no recent trauma other than this. He's well perfused. He looks well. We got to get him in the bag, get him to the hospital stat.
All right, I'll take over from here.
Yeah.
Thanks, Doctor. Gormley, then we dap.
That's right.
Big,
huge. Yeah, there it is.
That was awesome.
That was an awful report, but if I had an actual patient, I could probably
you were just improvising there. That was good improv. That part right in the middle of that section.
Yeah,
you
I
just
kind
say
of
where
blacked
you're
out
saying,
there for a second, but
You're saying no. I'm saying you're saying some words like right around the tachycardic area.
Oh, yeah.
That's like ASMR for me.
Right.
That scratches my brain hard.
Yeah.
I'm like, yes,
It's
words.
Tachycardia. Yeah.
Words that are strange and foreign to me. Oh, I love it.
Yeah, it's cool. It's cool. I like it because it's the thing that I like about paramedicine in general, and all of it is just that it's like you're a detective trying to figure out the puzzle, you know? But it's a puzzle that no one else has had the opportunity to figure out yet. Because I feel like in hospital, like, you have a chart for the patient, like you already have like their name and their info and their like, you know, past medical history and everything. But for me, I'm just in their living room.
Yeah.
It's like
you are the one who is
that's it.
Starting the domino effect that's going to result in that chart.
And like, you know, if I want to know their medication, sometimes it's like, you know, an 80-year-old woman that's on the floor. I got to go searching through I got to go to the bathroom. Awesome. I got to go check it out. Yeah.
That's so, I mean, that makes sense.
Yeah, right.
That makes sense.
I mean, it's all the things you don't think about, or like trying to find, like some people will refuse to leave their home.
Okay.
Like, and go with us. They'll be like, you know, like say grandma has an infection and she doesn't want to go, but the family wants her to go. Well, sometimes like, you know, she'll be like, nope, I'm not going without my handbag. I need that parka from the, you know, closet. My health card, yep, that's in my wallet. That's in the other room in my walker. You know, so I'm trying to figure, you know, trying to collect like a whole to-go
You're
bag.
You're doing fetch quests for
exactly. Yeah, exactly. And then at a certain point, I'm just like, okay, that's like, that's all we can take.
We're going.
Yeah, that's all we can take. And we got to go. But yeah, it's always interesting, the characters that I meet on the job, because there's certainly a good few of them.
Yeah, because you're just taking like a total vertical slice of humanity.
Yeah.
Like the demographic is just anyone.
It's anyone. And that's the other really cool thing about it is like, because I mean, I don't know, when I'm not at work, I'm just like a regular person going around like the streets of Guelph and going grocery shopping and things like that, and I live
they don't know
with roommates where I sublet a room, you know what I mean?
Yeah.
Like it's not.
Are you telling me you don't live on a school bus
No, well,
no.
You know, I still have my bus, but
that's good.
It's cold in there.
True.
Yeah, but I find it really interesting because like I'll go everywhere from like really like below the poverty line kind of areas all the way to like walking into mansions, like where, and it's funny because the be all and end all is everybody needs them at some point, right?
Yeah.
It's like everybody's gonna call 911 at some point, and they are gonna want somebody to show up, right? And it's like, it's so interesting. I always think when I walk into those like big mansions and stuff, I'm like, I would never be like invited here any other time. You know what I mean? Like I do not know anyone or like have any relation to actually be in a place like that.
But here I am now, an honored guest.
Yeah, and home. like they want me more than anything else in that moment. You know what I mean? They're like, hey, help me.
They call the special phone number that results in you going to them as soon as possible.
Yeah, exactly. And yeah, I think the other big thing that I feel like I have to mention on behalf of all like paramedics and everything is that, like, I think the misconception from the public standpoint is that like every call that we go to is an emergency.
Okay. That is how I feel.
And that
is my misconception.
That just isn't the case.
Okay.
Like,
how do you figure? Tell me more.
I'm telling you, like, I think they did a study looking at like all of the calls that paramedics were doing, and they looked at like the difference between how it was dispatched, like whether it was dispatched as like an emergency call versus what it was like diagnosed as in the hospital and them being released. And they found that I think it was upwards of 60% of calls that we get are non-emergent.
Whoa.
Yeah.
Whoa.
Yeah. Like, I've had people call me to put their socks on.
Wait, what?
Yeah.
Tell me more about that, please.
Yeah. Like, well, because that's the thing. I feel like at the end of the day, sorry, I'm a bit ill here.
Hey. Yeah, you're ill. You're really cool. That's true. You're like sick.
Yeah, I'm sick. But yeah, I distinctly remember like people will call when they have this idea that they have nothing else left. Like they don't know the solution. So what is the solution? To bring somebody to my house that does figure
They'll
things
fix
out.
you up.
Okay, yeah, 911.
I guess it's like the very, very, very bottom of the social safety net.
Exactly.
It's like
yeah,
you've gone
we are.
past every other thing.
We're the catch-all of everything, and yeah, so sometimes that means like somebody doesn't feel like they can get out of bed to put their socks on, and they want me to put their socks on for them.
That's so.
And it's like, oh, that's sweet, but
it's also
like, oh my god, yeah. So I don't know it, but like we go to so many of those, or even people that don't like know. I think it's like people there are definitely people that call that know they should not have called for what they're calling for, but then you also have this huge subset of people that like just don't know, like because I feel like a lot of people don't know.
Yeah, sure.
About...
I don't know.
Right.
The specific, like, okay, how bad
like,
does
there's no
my
list,
bike
right?
injury need to be?
Exactly.
Like, okay, let's say I, like, break my leg. It's like, okay, oh, man, this really hurts really bad.
Yeah.
I fell off my bike
yeah,
and
like,
I broke my leg. Do I call the ambulance
right.
or do I call the homie to drive me to the ER?
Yeah.
I don't know.
Well, and even, like, the way that it's dispatched, like a broken arm is dispatched as the lowest priority call we can get.
Okay.
Right, and you think like that's but he's got a broken.
If he's got a broken arm, like maybe he can't get himself.
But there's no life threatening problem there usually, But yeah, it's so interesting to see like what people's threshold is for for calling and like figuring out what it is that I can do for them. Sometimes is the difficult part. Is like, I don't even know. Like, I'm trying to think of an example. I can't really obviously give real
specific examples,
but like just people that say the big one, car accidents.
Yes.
Like we've already talked about, but car accidents. Like, I think people, when you hear car accident, you think like crazy big smash, like everything's destroyed, everything's on fire, and people are really hurt. But like with modern cars, I would say like, I don't know, 80% of the car crashes I go to have no injuries.
None. Even
when like the car is like crumpled and destroyed, because like the inside of the car is okay. There's airbags and stuff, but that's the thing is we get 911 calls for car crashes usually probably every time there's a car crash, right? Because it's like, people are like, I've been in a car crash.
I certainly, as a civilian, would assume that 100%.
Yeah.
If I get rear-ended and my airbag hits me in the face, I'm like, all right, 911.
Time to get assessed.
I got a conky or whatever.
Yeah.
Or I wouldn't even think necessarily that I got a little conquerino. I would just think that that's standard protocol.
Right.
I wouldn't even second guess that. I'd be like, all right, now I'm going to do the thing that someone does when they get in a car crash.
Exactly. And that's the thing. It's like a social like norm, I would say, is like, okay, I've been in a car crash. Now I need the paramedics to check me out. And I find that the funniest.
Well, to get back to my little car crash anecdote, my real life car crash anecdote, I feel like they need to share this. For context, if your listeners here haven't listened to this episode of the Passion Show, when I was 17, I got in a car crash.
You're 17.
Yeah, right. Man. And it was a pretty big one. I'd say it probably did qualify.
I would say definitely qualified.
There are some pretty intense injuries in that. But we actually did not call 911 first, which was the dumbest thing.
But I can see why.
The first person that we called was Lumpy, the director of our summer camp.
Yeah.
We're like, we got to get Lump. We have to alert the
Dad.
Lump man. We need Pup Dad.
Yeah.
And then we called my mom.
Oh,
and then we called 911.
Right. After your mom said, call 911.
Yeah, exactly. Very dumb. We were children. We were babies.
Yeah.
So I guess we can sort of forgive us.
But that's so understandable. Like, and yeah, like people, yours was most definitely needed But yeah, I'm just always amazed, like, because people will come out of it like unscathed for the most part. Like, of course you get hit in the face with an airbag and your seatbelt gives you some marks and stuff, But like, I always find it funny that people almost expect themselves to be more injured than they are.
Yeah.
Because like I get there and I'm like, hi, how are you? Like, do you want me to check you out? yeah, like okay. And then they come in the back of the ambulance and I'm like, okay, so like, how are you feeling? And they're like, I don't know. I'm like, well, you know, do you, I'm like, do you have like pain anywhere? No. Okay. And like, did you lose consciousness? No. And I'm like, okay. So
Sweet. Epic.
like, I'm like, yeah, I don't know. But it's almost as though they're like waiting for me to be like, actually,
to validate it a little.
you have this great, like, you know, you must have internal bleeding, you know, or something like that. And it's like, yeah, most of the time, like, if you feel all right, you're probably okay.
That is fascinating.
Yeah.
It makes sense.
Yeah. And it's like, I think they just don't realize that, you know, there are people that do get really messed up in these accidents too, you know, and it's like, man, you know, I think to myself, I'm like, man, you wouldn't have wanted to, you know, see the last one I was on compared to, you know. But
I'm sure we don't need to get into this too much. You've probably seen some insane things.
Yeah, there's been lots of things. That's the other thing about like talking more of the like human level of paramedic things is like I started when I was 21-ish, around there.
Yeah.
So, and like,
It's been a few years.
yeah, and I had just gone, like, I'd gone to school out of high school. Like, I'd gone to paramedic college right out of high school. And so that was my first, like, real job was doing that, you know? And I remember distinctly on my second ride out, because we do ride outs, like, kind of like an apprenticeship where, like, you're unpaid as a student for, you know, 400 something hours that you have to be with this one ambulance crew that you just go to all their shifts.
Wow.
And you're in the back with them.
Sounds like a laugh riot.
Yeah, it is. And if you get like a good preceptor like I did, then, you know, it's you learn everything and you also have a great time doing it.
Let's go.
But yeah, I remember like my second day on the job as a student on my 12-hour shift. And we got a call out for somebody that had been like just walking along the highway and got hit by a car. Oof. Yeah.
Yeah.
Right.
That'll happen.
Yeah. And I remember that like when I was whatever I was, 20 probably at the time, 19 even potentially.
Holy smokes.
Was seeing like a dead person for the first time. And that was crazy. And kind of coming to terms with that. And I remember the shift after that one, I came back, and I met my preceptor at the door, kind of like to be let in, and she was like, "Oh, I wasn't sure if you'd come back or not." You know, she's like, "That was kind of crazy yesterday. I wasn't sure if you'd, you know, show up again." But yeah,
I wonder what the dropout percentage is.
I don't know, because like we lose a lot of people between the first and second year of school, but
once you're past a certain point, you have to expect that.
Yeah.
You know, you're an adult. You knew
what it. Yeah. Well, and that's the thing.
19-year-old, you presumably intellectually knew, like, I'm going to see a dead body at some point.
You're at least like prepared for the kinds of things you'll see, but I think there's no preparation. Like,
not at all. There's like intellectual preparation,
yeah.
But there's such a big difference between that and like reality.
Really seeing, yeah. Well, and that's the thing too is, you know, and I'm still young in this profession. Like I've been doing it for 4 and a bit years. And like compared to, there's been medics that have been doing it for 30 years, right?
That's so cool.
And I've seen a lot, but I can't even imagine what these people that have been on for 30 years have seen, you know? So it's it's humbling to think about how, you know, when you think you've seen it all, you haven't seen anything yet, you know, and you can still, there's always something new that I haven't seen before. But that's kind of why I like the job too, is that there's always something different. Like you're never going to the same call twice.
It's like what you were saying with the detective aspect.
Yeah.
It's that every individual thing is like that.
Yeah.
And the whole macro scale of it is like that too. Every day, every experience is like
completely
something
different.
New and strange.
Even like you're working with a different partner who does things differently, or you're going to a different hospital, or you're, you know, whatever it is.
And just meeting a new human being. Yeah.
And like meeting these random people that you just instantly have like some sort of relationship with because you're with them at a very vulnerable moment. So it's like that kind of, it's weird when you walk into these people's homes and they're just like, yep, come on in. And it's like, they have no idea who you are.
No, they just know
call...
they see you and they see the car that you ride in.
Yeah,
and they're like, I trust this guy.
Oh, you have a uniform on? You're good to go.
Man, that is so... I did not expect to be thinking of parallels with summer camp.
Yeah.
But it does make me think, like, Celtic appealed to me for a similar reason. Yeah. In that we were just getting sort of like a random cross-section of
society,
the world, of Ontario.
Yeah.
Because the schools that were sending their kids to us were just random public schools.
Yep.
Just taking any kid. And
anybody.
If you're a child and you're 14 and you are in Ontario, there's a non-zero chance that you went to our summer camp. Yeah. No matter what kind of background you're from.
No matter where in Ontario you were from.
Exactly. Yeah. And I loved that. It was just like a roll of the dice. What kind of child am I going to be the father of this
for
week?
And
for these 3 days,
that parallel again of just like the parents being like, hello, wizard.
Yeah, right.
Here's my child.
Hello, Shiniblar the Destroyer.
Yeah, exactly.
Here's my darling boy.
Here's my most precious, valuable possession in the world. Hope it's all right for a week.
Please take care of this child while they climb rocks and shoot arrows and go on a sailboat. Yeah. So this is some dangerous activities.
Don't do anything crazy.
I've been thinking a lot about trust these days. I think a lot of the whole world is interacting with big. What does trust mean? What are our systems of trust, especially now that trust is eroding in the media and our technology. Yeah. And the real trust lives in community and in face-to-face people and, you know, Paramedic whose eyes you can look at, the trustworthy eyes of Connor. Yeah. Or Wizard the camp counselor.
Yeah. Schneeblar the Destroyer.
That's we've gone 2 for 2 in bringing up. I brought up Schneeblar a little bit in the last week's episode with Nash. I'm pretty sure he named Schneeblar the Destroyer. Yeah. You know, Schneeblar has lived on. I've carried on the good word of Schneeblar the Destroyer.
Yeah, you're a good man for
I keep that alive.
Keeping his memory alive.
I don't even remember this guy. It was a real guy.
It was a real person.
Wizard fans will know that I often, if I need a generic name to call someone, I will just call people Schneeblar because I think it's funny.
It's hilarious.
But it's a real person named by Nash. Yeah. So there you go. That's a little tidbit. We try to leave a little bit of new wizard lore in every episode of this show.
I like it. Well, and that's the other whole thing that we haven't even mentioned is that I went to this summer camp, Camp Celtic, as a child. I then was a counselor as well.
Yeah, you were. You were a normal counselor.
I was a normal.
And then.
And now, and for the past few years, have taken over their medical program.
So cool.
Yeah. And that has been a vastly different experience than I thought it would be.
Yeah? Tell me about it.
Because, like, my whole thing was like, okay, I love this place. Uh-huh. I like being a counselor, but like, what can I do to kind of level up my game with the skills that I have? Uh-huh. And I feel like a lot of the counselors is like, you know, this person's really good with like waterfront things. Okay, they're going to be kind of the waterfront dude, you know, or like drama, arts, whatever. And I was like, well, kind of the only skill I've developed is like is medicine. And I was like, well, maybe I can, you know, because we have like a little nurses station up there. Mm-hmm. And traditionally, it's always been staffed by nurses. Uh-huh. And then little old me came in and talked to Haney and said, who's the other owner of the camp, and I said, you know, what do you think about having a paramedic in there? And she said, well, we'll give it a try. Okay. And that was a couple of years ago, and since then, this summer actually, I believe we will be mostly, if not entirely, staffed by paramedics.
Whoa.
Yeah.
So what does that mean? Like, what is the effect of that?
Well,
what's the difference?
This is the thing, is like the camp nursing job compared to my regular job is so different because like normally I'm dealing with people for like an hour max at a time. Usually it's much more serious situations than the summer camp, but I'm doing so much less emergency medicine at the summer camp and so much more.
That's good to hear.
yeah, which like in overall doing a lot less or doing much less severe things, which is good. But I'm doing so much more like primary healthcare, like what you'd get at your
Like
family
doctor-y
doctor
stuff.
or your, because like you've got counselors that are living up there for 4 months,
Yeah.
and those counselors get hurt, and
They do.
both mentally and physically,
And I would say
spiritually to their core, and often the only like space and the only people on camp sometimes that they can go to receive any kind of care, again, whether it's like mental or physical, is us. And
I can confirm this to be true.
Right?
Lord knows I've been physically,
He's been-
spiritually, and indeed emotionally
resuscitated
damaged and resuscitated at camp.
And that's the thing, right? It's like I never thought that I would be learning so much about how to like help with physiotherapy kind of exercises and doing like wound care for multiple days at a time and figuring out people's like emotional needs on top of all of it.
Yeah.
Not to mention the kids, like
Yeah. Holy
Getting-
smokes.
getting 200 new kids every 4 days for 2 months straight is sometimes without a break in the middle.
Oh, yeah.
Is crazy.
At the best of times.
Yeah, at the best of
There
times.
goes these 200 kids on the buses at the next
On the
200
kunkles.
kids. The kunkles.
Yeah.
Oh, those cursed kunkles.
And here's the next batch. And like that's the thing, right? I mean, like you said, it's this cross section of society where you have everything and anything. So like not only
how many diabetics this
Yeah.
week, how many kids are allergic to the color red.
Yeah, exactly, right? Like how many of them have and that's the thing now compared to how it was when, camp was starting back in the 80s. Is that these kids are coming with heaps and troves of both medical conditions and medications, right? And so like
Oh, the medication
Yeah.
upkeep must be insane.
yeah, and like dealing with and documenting all of that stuff and everything is just wild. But it's been interesting to say the least, but it's been such a mind opener, and I feel like made me such a better provider overall.
That's so cool. That's such a good angle. That's so
Yeah.
interesting to me. It's always great when you have your like focus.
Yeah.
And then you can go
A little different.
operate in like the orbit of that
Yeah.
and just get different angles on what you do.
And
Yeah, I
figure
love
it out.
that. I love that.
And
That is
do
so...
what I love at the same time, like, because it's still a place that I really enjoy, and the people that are there and the things that I can do, and I still find myself participating in a lot of non-medical things there, as much as humanly possible.
Yes.
And that I wouldn't give it up for anything. And
What a cool... That's so interesting. It's like... That's what... I wish... There's a world where I became a nurse. Just a straight up nurse.
yeah,
And I almost, it's a past lives situation.
Yeah.
It's like, I'm sure, there is that universe out there. And I think I would have enjoyed that a lot.
yeah,
And maybe there's a future for me in the medical field.
because
Who knows?
it's a people profession.
Yeah.
It's like I love talking to people and learning new things about people, and yeah, it really opens your eyes to that cross section and gives you a key to see things that you would never get to see as a regular,
And it's all thanks to the Kunkles.
It's all thanks to the Kunkles.
I'm really happy that we tied back into that.
Yeah.
That we made the whole stupid little
whole
Kunkle-
circle.
Some people would criticize this program
No.
for being the type of show where I derail a really interesting conversation to talk about Kunkles.
But
what if it's all serves an end?
Yeah. And I think it's a great analogy for life, like your Kunkles arrive with your challenges, your things,
Exactly.
your new things in life.
You
and
send off today's problems, and on the same
Today's
Kunkle
Kunkle,
arrives
yeah.
the next day's problems.
That's right.
And they're not just problems, but they're solutions too. The whole camp is run on kids.
That's right.
You need that stuff. That's breath. That's air.
Yeah. Otherwise, we'd just be a bunch of 20-year-olds
just-
running around with forest.
Running around in a field,
That's right.
trying to steal flags from each other.
That's right.
We're at the end of the show, pretty much.
My gosh.
We've
that
got,
went quick.
We've got, yeah, I told you.
Yeah. See?
It flies by. I feel like there's so much, and this is how every episode ends these days.
Of course.
With me saying, golly, if we could just run this back.
Yeah.
I have so much more I want to know. This conversation is evergreen.
Well, I'm here.
You're here. Yeah.
Let
sure.
me know.
We can always just make another one.
Yeah.
Who knows? Next season 7.
Season 7. Yeah,
Exactly.
we'll
I have
bring
a
it around.
strict no repeats within season rule.
I think that's a great thing.
I agree.
You got to get fresh.
You got to get fresh meat in
Fresh
here.
stuff.
But also, Summer can do her 4th episode.
Yeah.
Run it back, baby.
Why not? Let's get her in here. We love Summer.
Legend.
Yeah. That's great.
Yeah. Let's end this thing.
All right, let's do it.
We've got a bit of a tradition here on the Passion Show, where we like to end our episodes with the sharing of gratitude, which is lifted from Guelph Outdoor School.
I like it.
So I will go first, and you will go second, and that way you will, end the show.
Sounds good.
In the spirit of generosity.
I like it.
I am grateful today for the wind and the clouds and the sky. I'm grateful for the coming spring. I love the spring. I'm grateful for my mom, who was a nurse, and my dad, who is a pharmacist. And indeed, I am grateful for all of the medical professionals that are in my life and that exist in the world. And I'm grateful for jigsaw puzzles, and I'm grateful for my cat, Little Gray. What are you grateful
Little
for?
Gray.
We love Little Gray.
I'm grateful for a lot of things, but today, grateful, like you say, for the melting of snow and the coming of warmer weather. I'm grateful for this city and the opportunity to have both lived and learned here. And I'm grateful for all of the people that I have met in this profession and in my life, and them allowing me to become the person that I am today. Yeah, I'm grateful for a lot of things. Like you said, I'm grateful also for shawarma. And I don't have a cat, but yeah, I'm grateful for all the animals I do meet. I saw a nice woodpecker the other day.
Oh, love a woodpecker.
Love woodpeckers. So I'm grateful for those little guys too.
Speaking of being grateful for little guys, Connor, thank you so much for being on the show. This was amazing. I've been Wizard.
And I'm Connor.
And only love will stop the killing.
Only love will stop the killing.
Seul l'amour arrêtera le meurtre.
Only love.
Тільки кохання зупинить вбивство.
Only love.
Only love.
Nur die Liebe wird das Töten beenden.
Only love will stop the killing.
Only love.
Μόνο η αγάπη θα σταματήσει τον φόνο.
Only love. Only love.